You are listening to the Health and Wellness Connection podcast, the #1 wellness podcast designed to provide the latest information to help you achieve your health and wellness goals. Our show features exciting guests, the latest in medical research, and in-depth discussions in current trends on weight loss, nutrition, and fitness. No matter what your interest, the Health and Wellness podcast has you covered. And now, presenting your illustrious host, Dr. Barry, MD.
Hello, guys, and welcome back to the latest episode of the Health and Wellness Connection. I'm your host, Dr. Barry, MD. I am a board-certified emergency medicine physician who's actually here to provide a lot of information, especially when it comes to health and wellness and weight loss. Now, of course, I've been doing this for a while now, and I've been, making sure we put out a good quality product for you guys, but I want to make sure that we take it to the next level this year. We're going to really focus on getting more content out to you guys, because, every time you hear on the news about some, quack who's been exposed and this and that and had a huge social media following, I always wonder, man, I probably need to work harder, man. I know people like myself who actually work and have to, have a lot of other obligations. It's sometimes tough to get the show out consistently, but we're going to make sure we do that so we can help at least try to bring some truth out there to a lot of noise that unfortunately a lot of people are getting caught up in. And unfortunately, those who don't have, actual real medical background have a lot more time, so they can make a lot more content and more TikToks and all that stuff for you. But we're going to step it up. We're going to make sure we get you guys the content that you desire. I appreciate all the love for everyone who's requested more shows and wondering what's going on with the show. But we're going to make sure we get it to you nice and hot and making sure it's ready for you. And then we can at least try to keep up with some of the BS that's out there. Again, I'm your host, Dr. Barry here, the host of the show. And I want to make sure that you have any issues or questions, you reach out. We can be contacted at our email, drbarryhealth@gmail.com. Again, that's drbarryhealth@gmail.com. Also follow us on Instagram, Dr. Barry MD. As well, you can follow us on Twitter, Dr. Barry Tech Doc, as well as TikTok. That's Dr. Barry Wellness 1. So thanks for tuning in to this week's episode. A lot of interesting stories here. We're going to talk about some of the latest health trends as well as health news, as well as some other interesting articles that I came across during my research during the, regular, creation of the show. And kind of we go through some of the latest research and some interesting articles that come across my desk, which I will talk about at length here soon. So the first story I want to talk about is about one of these bugs, these actual new pandemics, mini pandemics, if you will, and that is known as RSV. Okay, now RSV is known as respiratory syncytial virus. It's actually a very common upper respiratory infection that you see a lot of time in kids. Certain hospitals I work at won't even test adults for it because it's so uncommon, it's so rare. And it's similar to the flu. You get upper respiratory infections. The thing about RSV, why it's unique, is that it's known for high levels of mucus production, which can be sometimes very deadly. It can cause obstructive processes, cause pneumonias, things like that. It's usually pretty well tolerated, though, the infection, but in older people who have weakened immune systems, anything can really be dangerous, so you got to be careful. And we're seeing that this year, that there's been an uptick in older people getting RSV. Now, usually, again, I'm an ER doctor, so you see people in the ER come in. If you see an older person with RSV, which is not that common, but if you do see one, you would assume they're around a young child, someone maybe a 2-3-year-old or younger. Those typically ones who typically get RSV. And you wonder, okay, how'd you get it? And so they'll say, no, I'm by myself. I don't even have any kids or grandkids, and they're sitting there with RSV. You're like, interesting. And it seems like there's a new strain or some sort of increase in adults getting RSV. And it's not something we have typically seen historically. So something that people need to be aware of. Now, RSV is still not as deadly as influenza, but it can definitely cause issues and it requires a whole different treatment strategy as opposed to how you would treat flu or COVID or other things. So just be aware, guys, there's a new RSV bug or a new, more common RSV that's causing more issues with the elderly. And elderly are usually a lot of times immunocompromised, meaning their immune systems are not that strong. So any kind of infection can really cause a lot of problems. So you want to be very careful if you have an older person that is around and You hear them coughing and sneezing and you're worrying if they have COVID or if they have flu. Could very well be RSV. So make sure you tell your hospital clinicians to check for that, to ensure they're checking for everything that could be causing these new infectious issues in the elderly. So, all right, guys. So the next story is going to talk about a concerning trend that we're seeing here when it comes to preterm birth rates. It seems that the U.S. is getting worse as far as a number of preterm pregnancies going into delivery or going into birth. What that means is that typically when you are, pregnant female, you want to be ideally, you want to be giving birth at term. Term is when the baby has fully formed all of its organs and he's ready to be an independent being. This is typically around 38 to 41 weeks. That's usually when it's believed all the developmental processes are complete and the child is ready to be an independent being and can survive on its own. Now, ideally, this is what we want. Sometimes, though, you have things that are known to disturb the process of conception and gestation, leading to babies coming out before they are supposed to. This is what we call preterm delivery. This is usually what's officially termed about 37 weeks, so a little bit like a week early. Now, the earlier that, the earlier a baby is delivered from that preterm area, the higher risk of disease, death, complications, and the like. So we do not want preterm births. This is a bad thing. When you see preterm deliveries, it's usually in mothers who are not getting proper prenatal care, people who are not taking care of themselves, maybe who are using drugs, things that are disturbing the birthing and gestational process. So usually it's not an ideal thing. And unfortunately, the rates in America have increased since 2006. So sorry, they were at their peak in 2006, but it seems like instead of going in the right direction, meaning less preterm, we're having more preterm. Apparently, the new report found that the U.S. preterm birth rate rose to 10.5% last year, which is an increase of 4% from 2020. So, which is very concerning. In the past about 6 years, the preterm births have increased. And this is likely due to a lot of things, including lack of prenatal health care, people not getting the proper care they deserve. And this also could be due to, as well, we have a large influx of immigrants who have come into the country. Many of them are not getting proper care as well. Some are also pregnant, showing up, during the last days of gestation to get care. And so some of these also may be affected by that. But overall, the trends are not looking very good. And it shows that, we have to work harder to get mothers the prenatal care that they need. It's to be very critical because, again, if you have issues with prenatal care, this is ensuring complications in the newborns, which can already put them at a setback when it comes to survivability. So we want to make sure we reduce this as much as possible. Again, the peak of the preterm births was about 2.8% out of 100. That's quite a significant amount of almost 12%, 13% of all mothers who were delivering were giving birth early, which is an extremely high number. You want it to be below 7% ideally, according to the general statistics, especially when you compare to other developed countries. I mean, the United States has some of the worst statistics for a developed country, and it shows another issue with our healthcare system, that we're not doing enough to ensure that everyone has access to the basic standard of care. Now, of course, if we break it down state by state, unfortunately, the usual offenders are still offending. Mississippi with the worst rate of preterm births at 15%, extremely high. You got Louisiana right behind them at 13.5%. Alabama is 13.1%. West Virginia 12.8%. Carolina 12.1%. So a lot of Southeast America, some of the worst preterm birth rates. Texas not too far behind, 11.4%. So, it's very concerning. Now, of course, some of the ideal states, those who have pretty organized healthcare systems, Vermont, one of the highest, one of the lowest rates of preterm birth at 8%. The reality is that most states in the country are not doing good enough. Most are in the C range, averaging between 8 to 9%. So it's just very unfortunate, guys, that, as a country, we aren't doing enough to ensure that mothers are getting all the care that they need. This should be a very intense focus by anyone who considers, the health of an unborn child extremely important. There's too much crying about abortion, which, people have their issues with, but they're babies who are committed to coming out of the womb, and there's not enough being done to ensure the mother has access to all the health care she needs so that she's able to ensure that the baby is as healthy as possible. So this is why I think a lot of people, who like to paint pictures and try to do a lot of things in the name of such causes, but there's a lot of issues that are not being addressed that are extremely important as well for the health and the well-being of the nation. So I think this is something that needs to be addressed, and I hope that the current administration and folks in healthcare leadership are looking at ways to ensure that we can reduce these numbers. All right, guys, so another interesting story has come across my desk, and it talks about night owls. Again, these are night owls, meaning people who stay up late, don't go to sleep early or at an appropriate hour. And people could say that's like maybe past midnight or so, you're still up and you got to be up in the morning or whatever. So it says that night owls, apparently your cardiovascular disease risk may be higher. And we're talking about significantly higher, like 16% higher than those who go to bed at a normal hour. So a new study published on January 28th in the Journal of American Heart Association found that night owls had a higher risk of cardiovascular events like heart attack and stroke. So we do know that this is not what we want. We don't want to have heart attacks. We don't want to have strokes. So what could be some things that we should be worried about as far as the night owl lifestyle? And they looked at all the different factors, and they found that the biggest issue is the actual behavioral patterns of those who are considered night owls. Things like use of nicotine, physical activity levels, things like that. Those are also usually at a decreased. It's not as ideal as you would find in those who sleep at normal hours. And it seems like, because of their activity, things that they're engaged in, especially, when they're up late at night, most people who are up late at night, very few are being productive, let's be honest. Now, that being said, people have a right to be up at night if they like to, and that's, part of being an adult. You can do what you like and go from there. But it seems like some of the behaviors may be getting them in trouble. Now, there's another study that came out, and they looked at the UK Biobank again, which is a large database of citizens of the UK that they help do research based on, different factors and different things that are addressed. And this cohort looked at adults from 39 to 74 who had not had a heart attack or stroke previously, right? And they found that, they got a group of people in this age range, again, 39 to 74. And this group was predominantly white, just over half were female. Average age of the group was 57. So it's looked at those people who were morning people, those who were evening people, those who were night owls. They looked at their lifestyle, and they basically followed them, and saw kind of what kind of, issues they end up developing as they continue to live their life. 14 years they followed these people, right? 14 good years. And they found that those who were night owls had a 79% higher prevalence of poor overall cardiovascular health. So again, they definitely had heart attacks, definitely had more strokes, 16% higher in this night owl group. And it was very alarming. People who have who are night owls, it's not simply because they're up at night. That's not the main reason they had strokes. They found that they had a far lower health profile. And it found that those who are night owls, are they smoking more, are they drinking more, are they doing drugs, are they engaged in other activity issues that like decrease, don't work out as much. And so I think there's some trend between those who are up at night and up to no good is still there. Your grandmothers were right apparently. So some of the tips that they're saying for those who are night owls, things you should try to do to help reduce that risk of increased heart attack and stroke. Number one, stop smoking, be more active, get healthy sleep. Even if you're not sleeping at night, if you're sleeping at least 6 to 8 hours in a 24-hour period, that's actually very effective. Managing weight, controlling cholesterol, managing your blood pressure, managing your blood sugar, and eating better. Those things coupled with even a late night lifestyle can help you reduce some of those risks. So it's so important, guys, that if you're a shift worker, you're working overnight, and you have the circadian rhythm misalignment, ultimately you can overcome those if you're doing what it takes to ensure proper health, especially when it comes to diet, exercise, reducing harmful activities, things like that. Circadian rhythm is helpful, but if you're up in the morning and then going to bed at the proper hour, but you're eating like crap and not being active, you're still going to have heart disease. So I think, we got to ensure that we're doing everything we can to be as healthy as we can. And if you're someone who's considered a night owl, like myself, I'm actually a night owl. I usually work nights. but you have to be extra focused on health and wellness, as well as eating right, getting your good sleep, because your night out doesn't mean you shouldn't be sleeping. Sleeping is critical for proper health. So 6 to 8 hours a night, or whenever you sleep, is ideal to make sure that you're getting all that regeneration, as well as the anti-inflammatory effects and a decreased overall, issues that you have with not sleeping. So yes, night owls, get it together. All right, guys, another interesting story talks about ketamine. Ketamine is one of those drugs that's been around forever, and we're not really sure what to do with it in the medical community, and they're still trying to figure out where is it actually effective. Ketamine was designed back in the 60s and 70s. It was actually a drug back then. It was founded in some labs, and they discovered that, hey, this thing can make you feel good, make you hallucinate. So, of course, it got abused on the underground market. It was known as Special K, used as a drug by popular amongst the hippies and those who were in the know. Now, eventually, it found its way into legitimate medical usage, where currently it's used officially as a sedative. We use it actually to do procedures in the hospital. It actually can dissociate your brain from your body, basically, so you don't feel pain. And so it can be effective for doing procedures and doing different things that can help kind of, correct issues. Like, for instance, in the emergency center, we use it to help, when someone has a dislocated joint, we may give them ketamine, help them relax, and then we'll do the reduction. Or we'll actually, set bones and people have fractured bones, help them set their bones and help them use this drug to help them relax. So ultimately, it's a very powerful medication, but all of its effects are still coming out, and there's new research showing that it could be actually more effective in treating issues pertaining to mental illness. So they feel that things like depression, anxiety, suicide ideation, patients are getting benefit apparently from using ketamine in these situations. Now, again, a study published by the Journal of Clinical Psychiatry shows more credence to this belief. And this is a big deal because ketamine, once believed to be, a kind of a harmful street drug, is now potentially getting some effective media that shows that it could be a very powerful medication to help treat other illnesses that they didn't believe it could be effective in the past. Now, that being said, any of these street drug users always said ketamine made them feel good. So that was kind of a sign that maybe there's some help as far as people with depression and suicide. Now, that being said, you got to be careful when it comes to drugs for depression, suicide, because they can definitely have their issues. But, unfortunately, people use them quite a bit. There's a lot of antidepressants here that people are using successfully, and they're able to continue their life. And I think ultimately, if things allow people to get back to normal, functions in life and able to take care of their family and friends, I think it's something that should be looked at for sure. So one research that was recently done had a total of 424 people with treatment-resistant depression, meaning they were treated for depression with the traditional methods, both psychotherapy and medications, were not getting better. And this is something we deal with a lot in the emergency center. People come in the ER completely suicidal, and it's very devastating. And people who are functioning adults all of a sudden have an issue they cannot deal with, and it becomes something that destroys their life. And you see it happen. It's very depressing. You want to give these people the most help that they can. And so this group was, again, a very specific group, treatment-resistant depressive patients, and they were treated with ketamine infusions. Now, they had a whole survey they filled out before and after, and they kind of assessed them, and they monitored them with 6 infusions in 21 days. So they said that within 6 weeks of beginning the infusions, half of the participants responded to the treatment, and 20% said their depressive symptoms were in remission. This is after 6 weeks, half the participants had responded to the treatment, meaning they were less depressed. And then 20% had depressive symptoms in remission, meaning they had pretty much no more symptoms left. They were essentially back to their baseline. After 10 infusions, response to remission rates were 72% and 38%. So, a great response to the actual treatment. People felt better, apparently, as soon as the treatments started. And it just shows a pretty effective response rate when it comes to depression, which is something, again, that's been very difficult to treat for many, 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 many decades. So, it's something that just shows that ketamine can definitely be an effective use in this area. Now, that being said, this is a very small study. 424 people is not a lot. But again, this is a very difficult group as well. Again, treatment-resistant depressive patients. So I think definitely more research should be done. We need bigger studies to look at kind of how effective this could be. And of course, ketamine is not without risk. It's a very strong sedative, and it needs to be given in a medical setting so that someone can monitor heart rate, things like that. It's not something you can just take you can take a pill, but it's not as effective. And so the IV infusion method, which is what's typically used in these studies, is something that's a little more intense. But if it's showing this kind of improvement, I think that's something that needs to be looked at for sure. All right, guys, another study looks at some new positive information, actually. It shows that U.S. life expectancy has jumped to a record 79 years in the year 2024. Now, 79 is pretty decent for where we had been. I think we were 76 a few years ago. But compared to some other countries that are, I would say, some of the best places to live in the world, we still have a ways to go. Monaco is still number one at 86.73 years life expectancy. San Marino is number 2. Hong Kong, number 3 at 85.9. Japan, number 4 at 85.15. South Korea is there as well as 84.64. Saint Barthélemy is number 6 at 84.63. Then you got Andorra, French Polynesia, Switzerland, Australia, Italy, Singapore, Spain, a lot of countries with some good food, good weather, a lot of the things you see on these lists. So 79 as the U.S. is not great, but it's definitely better than where we had been. And it's believed that these new numbers and the recent uptick in this life expectancy for the United States has two big reasons. Number one, COVID. COVID was just tearing us up, man. It was really bad for the United States health system. We did really poorly. A lot of people died. It was just very unfortunate. It showed how fragile our healthcare system was. And apparently since that, devastating period, we've definitely improved. There have been less deaths in COVID since those initial periods. And actually, COVID, which held the top 10th spot for reasons of death amongst folks in 2023, dropped to the 15th position in 2024. So it definitely was an improvement in our COVID survival rates. A lot more people surviving COVID. Many people attribute that to the less virulent strain of COVID that has now kind of reigned. The first COVID was just a devastating virus. It did a lot of damage. But the subsequent COVID mutations have actually been a lot milder, and the vaccines have been effective as well. So now we had just a lot lower deaths from COVID, so that has helped these numbers improve. Also, another big reason why the death rates have improved due to the decrease in drug overdoses. That was a big one, guys. From 2023 to 2024, there was a 26% drop in deaths from drug overdoses. And the big one, of course, is fentanyl. Fentanyl was just wiping people out, man. And someone who works in the ER, I saw so many cases of patients coming in thinking they were getting marijuana or they were getting meth or something, and find out it was laced with fentanyl. So they'd be coming in fighting for their life. And unfortunately, drug use is bad. Street drug use is terrible. But unfortunately, there's a lot of people who were lacing these drugs with fentanyl, and they were killing people left and right. And it was very unfortunate. So, one thing I will say that has been a benefit since the new administration, there's been a lot less fentanyl coming across the border, which decreased availability, decreased opportunity to overdose. So that has helped the, rates of survivability go up. So with less overdoses, 26% drop from 2023 to 2024. I mean, it's pretty amazing. So that has also helped increase the life expectancy as well. So overall, I think we have a lot more ways to go. I mean, to get to that Santa Monica, Japan range, we got to do better. But 79 is still improvement from 76, so we are moving in the right direction. Hopefully the good momentum will continue. All right, guys. So another interesting story I want to talk about is some of the new data regarding GLP-1s. Now, GLP-1s, of course, I think they're a miracle drug. They're helping reduce a lot of things that we've come to deal with in the healthcare system, and we're going to talk about that as well. But some of the things that they have been proposed to potentially benefit include people suffering from multiple sclerosis and Parkinson's, even potentially Alzheimer's, because again, there's some belief, and there was some positive data seen in some of these other studies where they noticed patients who had these conditions were improving from those conditions and losing weight. So they thought maybe there was some benefit there directly. So some studies were done specifically for multiple sclerosis, where they looked at whether or not there was some improvement in the multiple sclerosis symptoms on patients who were using GLP-1s. And they looked at, these studies are pretty small, but they did kind of analyze these directly to see if there was any credence to these beliefs. And it seems like they were not really there, meaning that people weren't really improving in their multiple sclerosis and things like that, and Parkinson's illnesses. Now, they did lose weight. They were getting slimmer, which is good. But the bad thing is that they weren't really improving as far as the injury patterns seen with multiple sclerosis patients. And there was no real improvement in their mobility and their functionality. The belief was that, GLP-1s are known to be very anti-inflammatory. So if you can reduce inflammation, some of these inflammation-based illnesses like multiple sclerosis could potentially have a reduction in severity. And we know this is the case because patients who have these conditions, when they're obese, they tend to have a worse outcome. So if you're obese and you have MS, the inflammation can get worse. You're going to actually have worsening symptoms, further progression, things like that. And we know obesity is a pro-inflammatory condition. People who are obese have generally higher levels of inflammation, which can worsen everything from infection to other chronic illnesses, things like that. So obesity, something you want to definitely work on because it can definitely cause other things to be much worse. So ultimately, they looked at this condition when it comes to treating multiple sclerosis, and they found that there was really no benefit in the symptoms of multiple sclerosis. It was great for weight loss, but didn't really do much else for the illness. So this goes to show that GLP-1s, while they are great medications, they aren't wonder drugs. They can't treat everything, but they can definitely do a lot, I think. And so let's talk about it a little more when it comes to obesity as well, because that's important. Now, obesity, new studies show that it's linked to increased severe infection risk. So guys, if you're obese, just know that you're increasing your risk from death from severe infection, and this is from all over the body. Simple cellulitis can become a very deadly infection. And the reality is that when you're obese, you just have a lot more energy, meaning a lot more fat, a lot more kind of storage of fat, which is basically a great food substrate for bacteria, things like that. So if you're getting sick and you get an infection, the bacteria has a lot more energy to work with to stay alive. Even if you're treated with strong antibiotics, if there's enough food there, you can hide out, things like that. Also, fat is a great place for bacteria to hide. Antibiotics can't penetrate fat as easily. So that's why cellulitis becomes very tricky to treat in patients who are morbidly obese, just because of the difficulty of the bacteria to be attacked. And so things like that could be, of course, increase your risk for complications, things like that. But, as a clinician, we've known this, but when it comes to actual objective data, there's some new massive studies that have come out to just to prove this without a shadow of a doubt. There was two finished studies that looked at over 67,000 people, right? And I mean, these are massive studies. One was 67,000, the other was 479,000. So almost 500,000 people in one study, almost 70,000 people in the next study. Looked at people who had, infections or whatnot, followed them for many years. The mean age of the patients were 42 years of age. And they found that those who had, been followed, they found a large amount of infection that occurred in both groups, but they found that those with obesity had a 70% greater risk of either fatal or non-fatal severe infection. So can you imagine, like, that much higher, 70% risk, higher rate of severe infection. Someone of normal weight would get a small infection, would clear very simply. Someone of more obese body morbidity, body habitus would potentially get an infection and almost die from it. And infections are very scary because some infections respond beautifully. Other infections, you can throw the kitchen sink at them and they will not improve. It's just very disturbing sometimes how you see it. If you're in the medical field, you'll know this, because someone can come in, same infection someone else has had, and they'll be just deteriorating despite all the interventions, all the treatments. And so it was like, COVID was like that. It was very odd because some patients would get COVID, clear it quickly. Other patients would just become ravaged by the infection and easily die. So you got to be careful, I think, when it comes to infections. And we do know obesity reduces your immune system's effective ability to fight infections. Pro-inflammation states reduce your ability to fight infections. So that's why weight loss becomes so important, because it helps your body perform better and helps keep you alive longer. So it's just so important, guys. So this is also the reason why we also focus on helping people lose weight. GLP-1s, I think, have been a game changer, and we're going to talk about that as well very shortly. And so if you do want help with weight loss, I myself am a weight loss physician and been helping people do that. And I'll definitely help you as well. So give me a call, or you can just send me an email, drbarryhealth@gmail.com. We'll get to you. We can get you set up here, because again, I think weight loss becomes critical when it comes to helping prolong life and reducing complications and things like that. So we say, Dr. Barry, GLP-1s, they get a lot of hype and stuff, but is it really better? Like, what is it really doing as far as the overall health of the individuals in America, or in general? Like, is it really making a difference? And the question is absolutely. The answer is, I should say, is absolutely. So a new study has come out recently that talked about how GLP-1s are essentially changing hospital admissions. meaning that before people used to come in the hospital with certain illnesses, and now you see almost none of those people coming in anymore, and there's new illnesses coming in or new type of patients in the hospitals. So they looked at patients who used to come to the hospital a lot, meaning patients who had like diabetic complications, patients with significant obesity, heart failure patients, things like that. And they found that those who had these multiple kind of hospitalizations in the past, once they started GLP-1s, they had markedly decreased hospitalizations, markedly decreased complications from their chronic illnesses, and just overall just healthier outsets. They just weren't as sick. And this is a big deal because, hospitals have been designed around these chronic illnesses that have known to be common in Americans. Heart failure is a big one. COPD is a big one. Diabetes complications, things like that. So if people are getting these new medications and they're losing weight, they're not getting sick anymore, they're not getting hospitalized as much anymore, it affects how the hospital has to practice because they won't be as much of a need of like maybe immediate, stroke care or immediate heart attack care, because if people are not having heart attacks as much, then the cardiologist doesn't need to be on call 24/7 anymore. Things like that. This is like a big deal because once the hospital has seen how the patients are being affected by certain treatment plans, and it's a big enough effect where it affects who comes in the hospital, then it becomes like a business decision. Now, of course, it's kind of early to say that officially, but the numbers are already showing that patients who are known to be chronic admissions into the hospital are now not requiring as much admissions, and it's changing the landscape of the hospital inpatient situation. So it just shows that, when it comes to what everything boils down to in this country, dollars and cents, it's going to be a big change in how things are. And this is a great change, to be honest. I mean, people who had like diabetes, who were coming in the hospital all the time for blood sugar issues or metabolic derangements, things like that, now they're not coming to the hospital because their blood sugars are being well managed. They're losing weight. They're feeling better. They're not as sick anymore. That's a great thing. And so I think it's going to be a great thing as far as see how we're able to adjust as a society and ensure that, we're able to, basically provide people with better lifestyles with, these new medications, as well as adjust to how it affects how things have been done in the past. So we are also seeing that one thing they've noticed that people who have GLP-1s can develop gallstones. That's a big one because they say that it affects rapid weight loss and they can affect gallstone production. So that's one thing people say, just be on the lookout for that. But overall, the decrease in chronic illnesses in the hospital is just a glaring sign that GLP-1s are making a big impact as far as chronic health and chronic health maintenance. So stay on the lookout, guys. There's going to be a lot more changes like that in the future as GLP-1s continue to penetrate and be a ubiquitous, common treatment for a lot of different issues. All right, guys, that's the end of this show. Thank you for joining us today at the Health and Wellness Connection. Really appreciate you checking us out and just, rocking with us. We're going to keep the show going. We're going to keep the vibes going. And if you have any questions or any shows you want us to do or talk about, please reach out. Email, as you can reach us at, is drbarryhealth@gmail.com. Also on Instagram at drbarrymd. Also on TikTok, Dr. Barry Wellness 1. Thank you for everything, and thank you for just listening to the show and just being a listener and just help and just keep the vibes going. Forward this to your friends, family, share, show some love. We appreciate you. Until next time, peace.
Thank you for listening to the Health and Wellness Connection podcast and radio show. For more information on ways to get healthy, please check us out. www.anchor.fm/HW Connection. Here you can re-listen to the show, check out older shows, and even further support the show by becoming a subscriber to the podcast. Please check us out today. Again, that's anchor.fm/HW Connection. And also, don't forget to follow Dr. Barry on Instagram at drbarrymd. Until next time, stay healthy.